the Javelin Bladder 100, certainly we saw toxicities, and while toxicities are seen with avelumab, I would say that most were in line with what you would expect for the use of checkpoint inhibitors in clinical practice. Now, there are two general categories of adverse events. One would be the treatment emergent, AEs, or treatment emergent adverse events, which is any AEs, any toxicity that happens regardless of whether it's immune related or not. So for this, fatigue is one of the most common that we've seen in Javelin Bladder 100 that occurred in most commonly, as well as pruritus, as well as UTI. Although I would say that some of these, for instance, like urinary tract infections, may be more related to the disease process itself rather than the drug. But be that as it may, there were no grade 4 or 5 AEs, so that is comforting. And the treatment-related AEs led to discontinuation rates of about 11.9%, 12%. So I think that's a reasonably good number. And the use of steroids, high dose steroids, which is defined as 40 milligrams or more of prednisone, was seen in about 9%. So that is certainly a reasonable treatment-related AE profile for any drug. Now, one peculiar thing I would say about the use of avelumab is that there is a higher incidence, probably than most other checkpoint inhibitors, of infusion-related reactions. And it occurred in about 10% of patients in the Javelin Bladder 100.
For grade 2 pneumonitis, which is a serious condition, we obviously hold the immunotherapy, start the patients on steroids. If the patients need to be admitted, then we do that. But usually most patients improve with steroids. And depending on the severity, we make a decision once everything has resolved. Most often we don't re-challenge with the immunotherapy, depending on the severity.
I do believe that the side effects we saw from avelumab in the Javelin Bladder 100 is in line with what we were seeing too in the second line treatment for metastatic urothelial cancers. Now, I will say in the earlier phase trials for the second line treatment and beyond, there seems to be a little bit more infusion-related reactions, close to about 30%, which we did not really see in Javelin Bladder 100. But other than that, I think it's fairly comparable. Again, the grade 3 or more AEs that was associated with avelumab, including UTI, that's urinary tract infections, anemia, hematuria, and fatigue. A lot of them, again, may be related to the disease process itself. It is well known that patients with bladder cancer, especially if they did not get primary treatment because they were metastatic at the very beginning, at the time of initial medical assessment, they would not have undergone, let's say, cystectomy. So some of them may present with hematuria. Now, it's important to note that none of these treatment-related adverse events, albeit they were grade 3 or more, had more than 5% in terms of incidence and prevalence. So, and remember too that these were treatment, again, emergent AEs, so they're not necessarily related to immune-related toxicity. So it was any AE that happened within the trial.